Welcome everybody. We'll get started in a couple of minutes while people join. But you are in the right place. Today we're talking about health insurance for co-ops. I'm just going to wait one more minute and then we'll get started. All right. Why don't we go ahead and get started? For those who join later, this will all be recorded and resources will be shared, including the slides. So thanks everybody for joining us. We're really excited to have everybody. I'm Chris Linder with the Cooperative Fund. I'm one of the main representatives for the Cooperative Fund, and we're really excited to have this conversation happen today. It's very timely. One, we're still in Cooperative Month. Also, Worker Ownership Month is this month, and we're about to run into the season between now and January for signing up for health insurance. So it's very good timing. So as mentioned, we're going to talk about health insurance today. We can go to the next slide. Today, we're going to have someone from Wheeler Insurance talk about what are the health insurance options here in Maine and the different levels. And then we are lucky to have one of those options here today from Community Health Options, one of the locally based options to talk about them in particular. And then we're really lucky to have one of our great partners, the U.S. Federation of Worker Co-ops, speak about some of the options they have for health savings accounts, as well as dental and vision plans that we can all use as cooperatives. Even if we're not worker cooperatives, you can join, and then hopefully some Q&A. We can go to the next slide. Thanks. So I'm going to hand it over to Matthew of Wheelers Insurance, who is a great partner and an employee-owned cooperative here based in Western Maine. Take it away, Matt.
Thank you, Chris. Good morning. My name is Matthew Sear. I work at Wheelers Insurance. Wheelers Insurance is committed to finding you the best value in insurance. As an employee-owned independent insurance agency, we have the ability to shop our broad network of top insurance carriers to find you complete, accurate coverage at a fair price. Like Chris said, we've been an employee-owned company since January of 2020. We've actually been in business since 1864 in the same location. And we're independent, so we have multiple carriers for all lines of business. Next slide. Here's our health team, and we work with coverme.gov, which is the main marketplace where you shop for your health insurance. And why choose us? Our dedicated health team will guide you through securing the best coverage for you and your family. We pride ourselves in being locally rooted, having growing up with our communities, which everybody is around. Everybody from our company is Oxford Hills or Bethel area and grown up here. This year, Wheelers proudly celebrates its 160th anniversary, which is a pretty big accomplishment around here. Next slide. Here are the 4 carriers we currently have access to through the marketplace: Anthem, Harvard Pilgrim, Community Health Options, and Taro. Thank you. Each company has different metal levels. They start with bronze, silver, gold, and platinum. And with the metal levels, they break it down by deductible ranges and max out of pocket. The bronze has a higher deductible and higher out-of-pocket, but lower premiums. They also have lower co-insurance and also HSA compatible plans. And with the bronze plans, and to get a little bit more on the HSA side, and Maddie will touch base on that as well. When you select the HSA plan, it has to state HSA in the plan name in order to qualify. And the summary benefits will identify that for you. The silver plan is, I would say, the more popular plan, and it also has the ability for cost sharing reduction opportunities, which means your family size, income, and location will help you reduce the overall cost. Premium, out of pocket, deductibles, co-pays, and co-insurance all are reduced. So that helps people have better and more affordable coverage. Then there's the gold plan, which the deductibles are much lower and the out-of-pocket limit is a lot lower. The coverages are for co-insurance tend to be 20 to 25%, which you would be responsible for that. And they also have lower co-payments for people. The platinum plan, which there's only one platinum plan right now available, and that is with Community Health Options. That's a low deductible of 500 and a max out of pocket of 3,000. Next slide. To get a little bit more in depth on the cost sharing reduction plans, they're only used on the silver plans. You can utilize your advanced premium tax credit towards the reduced plans. The cost sharing plans will either have a suffix of 94, 87, and 73, which identifies how much your deductible, copay, and out-of-pocket maximum allowance. So based on certain income levels, your county and your household size will determine where you fall in the 94, 87, or 73. That includes extra savings on your medications, reduce out-of-pocket maximums, which really helps families at a larger size. They'll be able to obtain that amount fairly easily. I'm a really big fan of the cost sharing reduction plans with the access and the affordability for people, and it puts them in a really good position financially. Next slide. This is a really important feature for health insurance on the marketplace, the advanced premium tax credit. Accuracy is really important for this, as some people, if you underpay your health insurance, you'd be owing that premium tax credit back. And it's based on a formula, and I can provide that formula as well after. They're provided by the government to assist paying premiums. The government will send that money to the insurance company directly on your behalf, and you pay the remaining. That is also based on location, household, and income. The hardest part is estimation of your future income. And what we're looking for is the adjusted gross income. And for self-employed clients, you're looking at the net proceeds or the net income that you receive on either your Schedule C, K1, or other forms of income. I would recommend reporting any income changes throughout the year, as it avoids any payback for your premium tax credit. It could be substantial at the end of the year, depending on where your income falls. Next. I've put together probably the most popular terms in the health insurance world that people ask questions on and what it means. I won't go through all of them because there's quite a few of them. Co-payment, which means it's a fixed dollar amount that you pay for covered services. If you go to your primary doctor, a specialist, sometimes blood work, those are some examples. Your deductible is the amount you have to pay prior to the insurance company contributing any money towards your covered medical costs. After you meet your deductible, co-insurance steps in, which splits the bill between you and the insurance company. you will pay the percentage that's listed on your summary of benefits. And the insurance company will pay the rest. The special enrollment period is also another important one. It's a life-changing event that allows consumers to enroll into a health plan. And you can find those on the coverme.gov website to show which life changes are applicable for you. Let's see. Out-of-pocket limit, that would be the most you would pay before your health insurance pays 100% of all covered services. And that means you would have to be in network. Anything out of network, if you're an HMO, will not be covered. Let's see. The other one is a health savings account, which is a high deductible health plan, and it may be eligible for health savings account, which are pre-tax dollars deposited in an account to use towards your deductible, copay, co-insurance, medications, and other services established by the IRS. And I want to emphasize, you cannot pay your premiums with your health savings account. I've been asked that a lot, but you cannot do that. The preferred provider organization, which is a PPO, plan covers care from in-network and out-of-network providers with no requirement for referrals. That means if you want to see a specialist that you prefer to go see, you can schedule an appointment with them without your primary care sending a referral over. That cuts back on some time and some extra paperwork, and you may be able to get into that specialist sooner. The health maintenance organization is a type of insurance plan that only covers in-network providers. The only exception is emergency room care. If you go in the emergency room anywhere in the United States, that plan will cover you. And any other services, if you follow-ups or anything like that, you would have to check your summary benefits to make sure it's what's covered and what's not. And next slide. And I'm going to pass it over to Caleb.
Great. Thank you so much. And thank you everybody for the opportunity to be here today. So like in my introduction, I'm coming from Community Health Options. We're actually Maine-based, member-led nonprofit health insurance carrier that's in Maine and born in Maine. We're from Lewiston, and now we have offices in New Gloucester as well. Our mission is to partner locally with members, businesses, and health professionals to provide affordable, high-quality benefits and promote health and well-being. We work in individual, small group, large group, and self-funded. So we offer plans of all arrays. In 2023, the state of Maine merged individual and small group. So a lot of the plan structures in individual are very similar to small group now. So the BOI kind of created laws and regulations for carriers to follow to offer individual and small group plans. So this year, Community Health Options offers 43 total plans in the individual/small group market. And our vision is to be a leader in transforming and improving individual and community health and positively affecting local economies. We work very closely with a lot of nonprofits and a lot of great organizations here in Maine. Next slide, please. And due to the merge market, a lot of the carriers have to follow the same types of plan programs with deductibles, copays, a lot of the things that Matthew kind of talked about prior. And we have a few key programs that help us kind of separate and really be able to offer better benefits to our members. So the first one here is Firefly. Firefly is actually something that we adopted this past year, and it's been rave reviews in the sense of a lot of people here in Maine are having a hard time finding a PCP. A lot of people are going through a process where PCPs are retiring, or you live in more of a rural area and there's a really long wait time to see a primary care provider. Firefly kind of helps with that and brings a digital transformation to seeing your PCP. So really it is a phone call. It is an app on your phone that you can access 24/7. You will get a team of providers. So you get your physician, nurse practitioner, health guide, behavioral health specialist that you have access to anytime, anywhere. So really what Firefly is trying to do is getting people in front of their providers. There's no major wait time. when you sign up for Firefly, and it can be a temporary product as well. So say you're with Community Health Options and you want to use Firefly, it's not something that you have to sign up for forever. Say you have a year wait to see your new primary care at a facility that you want to see. You can use this in the meantime, so you can still continue care until you find a new provider. And it's the same team every time that you are assigned to. It's not a one-off. You get the same providers as long as you use Firefly. So it's a great product. We're really trying to, bring this product into Maine and really help people find, great primary care providers. Also, if a lot of questions we get sometimes is, if it's digital, how can we, get labs and things like that? So you will work with your provider and they will send you to a local lab to get those taken, or if they need to see you in person, there are brick and mortar locations here in Maine, and everything will be covered under your copay for Firefly, which would be your copay for your plans. So everything kind of works cohesively with us and Firefly. We also offer Amwell. Amwell is another digital tool. So it covers behavioral health and urgent care. So with behavioral health, it is more of a one-off. So if you're struggling with anxiety, you're stressed, we don't want you to feel alone, especially, post-COVID, there's been a lot of behavioral health needs, and not a lot of providers are either taking insurance or, again, long wait times. This is a great program to have somebody to talk to, and they will help you find a provider in our area as well if you need continuous care. So it's a great benefit. Same thing with Amwell Urgent Care. This is a great program where, I've actually used this in the past. I woke up with the flu. I knew I had the flu, and I didn't want to go into urgent care and wait for as long as it takes to see a provider. It's basically like FaceTiming a doctor, and you talk to somebody. They go over all your questions. They have questions, and then they can actually send your prescription to your local pharmacy. So it just kind of cuts out that waste of time, especially if you live in rural Maine. Urgent care might not be a 5-minute drive. So this really, again, we're a Maine-based company. We want to be able to service all of Maine. So we kind of take that in consideration to make sure that there's care provided everywhere. And then one of our most popular programs is our chronic illness support program, or CISP, as I like to call it. It's for all non-HSAs in the small group world. CISP is designed to improve the health and well-being of members with asthma, coronary artery disease, chronic obstructive pulmonary disease, diabetes, and hypertension. We actually have this program where it helps our members save money. So you can see here, select tier 1 generic medications designated with CISP on our drug formulary. Is a $0 copay if they use our mail order system, which is called ESI, or Express Scripts. And then on select 2 and 3 medications on our drug formulary, it's a 50% cost share reduction. So we're helping members get their medications at a cheaper price if they fall under one of these 5 categories. And it's not just prescriptions that we do, it's also doctor's visits, glucose monitoring, all these types of programs that are needed if you're, say diabetic or have hypertension or asthma. We help with inhalers and doctor's visits. So, again, this is something that we really strive for, to help our members get care. As a nonprofit, we really, want to help our members stay healthy, because it helps us in the long run as well. So, it's a teamwork aspect here at Community Health Options. And then we have site of care incentive program too. So we partner with preferred infusion providers to provide high quality care at a fraction of the cost. Members will be offered a monetary incentive payment when receiving infusions from a preferred site of care provider. So again, we're trying to work with members to get them to, one, we give them incentive to go to a infusion service that's in our preferred area to help save money, but also, motivate them to get high quality care. We actually do have another program called Price Assure. It's not on this list, but I just wanted to talk about it real quick, because it hits on the individual, small group, large group, where if a member is going to the pharmacy, everybody's probably heard of GoodRx. As prescriptions are very costly. What Price Assure is, though, is a program where we've partnered with GoodRx. When they go to the pharmacy to load up their prescription, they will actually pay the lowest cost. So the pharmacy automatically checks and it'll show the GoodRx price and our price, and the member will pay the lowest cost, but it still goes toward their benefits. So they don't have to download GoodRx, they don't have to look up coupons. It's going to show automatically the lowest price, and that's what the member is going to pay. But they still get the benefit of, even if they use the GoodRx price, in the sense of it goes toward their max out of pocket. So they're not losing out on that like, they would previously. If you use GoodRx, it doesn't go toward your benefits. So that's a great program that we started up this year, and we're continuing to push that because, again, we want to help our members save money. And next slide, please. Just want to talk about, as we are a nonprofit and we are the only Maine-based insurance carrier here. So when we make a promise to do something, we keep that promise. We strive to keep costs low while providing the benefit members deserve and employers need. We are committed to member satisfaction every day and always have their back. You can see down below, we had almost 81,000 member calls last year. The total time with members are about almost 12,000. The 26-second average wait time, and 98% caller satisfaction. One great thing about Community Health Options is if our members call in, and it doesn't matter if you're individual, small group, large group, when you call in, you're going to talk to somebody from Maine. All our member service team is located here in Maine. And it's all throughout. We have members in Fort Kent, all the way down to Sanford. So you're going to talk to somebody that knows the network. You're going to talk to somebody that knows providers. We are located here, and we're that Maine. We're Mainers looking after Mainers here. I always like to kind of say. So, yeah, that is all I have today. And this is a directory. So if you're interested in individual, small group, large group, you have questions. Here's our connections here, our member services number here as well, or contact your broker and we'd be happy to talk to you.
Great, thank you,
Thank you.
Caleb. Yeah, thanks, Caleb and Matt. So what we just covered are the main options on the Affordable Care Act exchange for Maine, which is great. I actually use it personally for my family. Now we're going to have Maddie from the U.S. Federation of Worker Co-ops talk about some of the options of how employers and individuals can use different programs within the U.S. Federation of Worker Co-ops. This is not just Maine-based. Any co-op can use this throughout the U.S. Just by joining the Federation. And a lot of it can supplement or complement what Matt and Caleb just covered. So, Maddie, take it away.
Great. Thanks, Chris. Hi, everyone. It's great to be here. So like Chris was saying, I am from the U.S. Federation of Worker Cooperatives, and I'm the program manager for our worker benefits program. Um, we offer a variety of types of support to our members all across the United States with navigating worker benefits. Our programs are open to all members of the USFWC, which includes all of our worker co-op members, but also organizations that join because they support worker co-ops or incubate worker co-ops, or just want to show solidarity and support for worker cooperatives and worker ownership. So this is a program that's pretty widely available. And so we aim to sort of create some easy on-ramps for our members, for small businesses and small organizations across the country to access different types of worker benefits. And I'm going to talk a little bit about our dental and vision insurance offerings, as well as the partnership that we have with an administrator of those HSAs and flexible spending accounts and HRAs that Matt was mentioning previously. So another thing that's also important to note is that, unlike Matt, I am not an insurance broker, but my role is to sort of coordinate and support our members in navigating sort of the landscape of employee benefits and worker benefits. So as a national federation, we have access to a group dental and group vision insurance plan. And I think we can go to the next slide. And so the important piece about these plans is that they're quite strong benefits at one price set across the country. So any of the workplaces that join our dental and vision program have access to those benefits at these rates. They said preliminary before, they're pretty much set at this point because open enrollment is coming up day after tomorrow. So we're able to offer dental insurance for $35.79 per person per month, or per worker per month, and vision insurance for $6.16 per worker per month. And workers are able to add dependents to those plans as well. And these are pretty solid plans for the dental. There's a $1,500 per year max, with exams and cleanings fully covered for both in and out of network dentists, which is important when we're dealing with our members all across the states, and particularly in areas where there are sort of disparate numbers of providers available, as I understand there are in Maine, and challenges in getting access in rural places. So even if your closest dentist is out of network, our plan could offer solid coverage for that. We also we have a per organization per month rate as well for groups that are enrolling, which is just to sort of cover the cost of the administration and our program work and implementation. Then additionally, we also have partnerships with a variety of vendors that offer other programs, other benefits. And one of those really important partnerships is with the Harrison Group, which administers tax advantage reimbursement plans. And that's an umbrella term for the health reimbursement arrangements, flexible spending accounts, and health savings accounts. These are like long terms with a whole alphabet soup of acronyms. But what all of them do is allow workers and workplaces to set aside money that is not subject to payroll or income tax so that people can use that money to support their healthcare expenses throughout the year. So the main benefit is reducing the tax burden, but it also sort of provides the opportunity to say, okay, I'm going to set aside this money so that it's available for healthcare expenses if and when I need them. We can go to the next slide. And so, as I think Matt was talking about earlier, these plans, they can pay for specifically, we can talk specifically about sort of the HSA plans that Matt was referring to. Some insurance plans are actually set up and designed with the assumption that you'll have a health savings account available to you, funded by yourself or your employer, so that you can pay out of pocket with those tax benefited funds to pay for any copays that come up when you go to the doctor, to pay for emergency room services or hospital bills. And it also extends as far as like your prescriptions and over-the-counter items, even things like Band-Aids or like menstrual supplies can be covered by an FSA, or an HSA, either one. And it's really quite expansive what they can cover. And then there's another kind of HRA, which is a health reimbursement account, that actually allows you to designate money for your workers to specifically pay for health insurance premiums. So we can go to the next slide, I think. Yeah, and so there are two types of HRAs. They work very similarly, so I'm not going to go into the real nitty-gritty of the mechanics of all of them. but we have a qualified small employer, HRA, which is built for workplaces less than 50 workers, and then an individual coverage HRA, which is built for workplaces over 50 workers, but there's some crossover as well. And what this allows you to do is say you have a workforce where people have really diverse healthcare needs. Maybe some people have really high health insurance, healthcare expenses. Some people have really low health expenses, or people live in different places with really different insurance markets. Even something like someone lives in southern Maine, someone lives in northern Massachusetts. Like there could be really big differences in terms of what those people's healthcare costs are because the insurance marketplaces are different. And so using these, instead of picking one insurance plan or a couple of insurance plans that your workers have to pick from, you're basically saying to your workers, here, take this chunk of money and go purchase your own health insurance. Pick what works for you best. And so this is something that our partners at the Harrison Group can do, can help you get set up with. And if you're a member of the Federation, the USFWC, you do get discounted um, administrative charges. It's not a particularly expensive benefit to administer, but there are some setup costs and ongoing maintenance costs. And then, yeah, it's sort of they support you to administer this on a monthly basis. Something that's very important to understand, though, about these plans is that the amount of money that a workplace gives an employee for one of these accounts will cancel out the equivalent amount of premium tax credit. So, as we were talking about before, with the premium tax credits that are available to help individuals pay for their health insurance, the insurance markets, the government, the IRS, whoever, is not going to let you use that tax incentive twice, basically. So if you have, say you have a $300 subsidy available based on your wages, and your workplace says, here's $200 for your QSERA, that's going to cancel out 200 of those subsidy dollars. So that's something to take into account if you're a workplace sort of looking at what the best options are. Obviously, as employers, we want to be providing our workers with the best type of health coverage we can. But it's also really important to make sure that we aren't sort of inadvertently disqualifying people from benefits they're otherwise entitled to. And so, yeah, I think that sort of covers it here. And this is our team, myself. You can contact me at benefits@usworker.coop. Schedule a meeting with me. I work closely with May Perez, who is our coordinator for both the benefits program and our membership team as a whole. And we're a pretty tight-knit team over at the Federation, and so are available to help you with these things as well as to familiarize you with our other types of member benefits, like technical assistance and supporting and getting involved in policy work and all kinds of things. So yeah, thanks for having me here.
Awesome. Thanks, Maddie. Thanks so much. Yeah. And we have a bit of time, and folks do start to put in the chat any questions that you have. One thing I wanted to share while we have time, because it's so recent for me, is I wanted to sort of cover from an employer and an individual experience, just my own experience with, being part of Cooperative Fund 5 years ago. I'm just an employee, but 5 years ago, we were probably 5 or 6 people, and now we're 15 people. And the Cooperative Fund realized that they really needed to beef up their benefits. And in working with the Federation in particular, um, uh, we decided on a few things. One was to join the QSERA portion of what Maddie mentioned, and I have to sing its praises because it's worked really well. And I've heard from my other colleagues, we're a multi-state nonprofit, 15 people, so under 50 people. CF&E puts a certain amount of money into our account each January, and we can use it for pretty much anything. And the Harrison Group has a great database, and you can check if it's allowable. But the great thing about the HRA is this year, my wife lost her employer-based typical sort of health insurance program through United Healthcare, and we had to go on to the exchange. And so the HRA does allow to pay for your monthly premiums for the healthcare. You just have to tell the Harrison groups. And so they reimburse us for that. But also when we go to Walgreens or go to the health provider and we have a copay, they give us these debit cards that you can't, it's probably faded out a little bit, but uh, you can basically use it as a credit card or a debit card to pay for things. And that has worked really well for me personally. The other thing that I would say is, as an individual, going on to the exchange is to meet with someone who's an expert to kind of get through that, because my partner and I, we met with one of these organizations that you can click on here, to really go through all the different 43 options just with community health options plus three more, all those different metal plans, and then also having to work out what is your subsidy. And we had to tell them how much of the HRA was contributed, um, and it was really helpful. And we landed, actually, so we're a community health options member, and it has worked really well for us. The HRA reimburses each month the thousand or so that we pay for our health premiums, plus any other copays that we have, and it's worked really well for us as an individual. Um, one thing one thing that I would just note is, a lot of co-ops are either in two places. One is kind of where we, the cooperative fund, were very, relatively small, maybe a startup, and just starting to think about how we can help employees access health insurance or health insurance like um, options like savings accounts and that sort of thing, as well as larger employers who are starting to think about maybe offering a group plan, literally a health insurance plan. And I think these options are one, I think employers can start to inform employees about what their options are. Maybe even bring in some of these folks to talk to your employees. And then think about some of those in between options, like like Cooperative Fund, my employer, is doing, the in-between options of offering an HRA, even though it's not a group plan quite yet, or helping facilitate one of the FSA, the savings accounts or the HSA accounts. Um, and then when you're ready, whether it's through community health options or one of the other options, there are what's called the small group plans, and that's for an employer who's relatively small, not a large employer, um, who can offer a United Healthcare or something like that, health plan, that's affordable for you as an employer. Um, I, I thought I would start. Um, yeah, that's a perfect question, John. Um, so where I would start, and I would open this up to all three of the panelists. Um, for a new co-op, or a small one who's sort of not been able, who has basically done a lot of, the bare minimum of, we pay our employee related taxes, and we pay for workers comp, and we haven't really offered benefits before. What would you all recommend for that, small co-op employer to do, how to get started? Because the in the co-op world, we have our own set of acronyms, but in the health insurance world, it's even crazier, particularly because the federal government's involved. So they love acronyms. So what would you all, and I think one piece of advice is just to talk to you all individually, or click on that link that I shared, to really get, understand the full situation that you're in. But yeah, Maddie, I saw you come off camera first, so I maybe open it up to you, but Caleb and Matt too. What would you all share as a, for a very small co-op employer to get started on thinking about this?
Yeah, I mean, I think it's a great and really important question, and I think that um the place to start is really like talking to someone who knows the options and getting a sense of what it will realistically cost to offer benefits. And I think like getting a sense of what your ideal is and a sense of how much that would cost and really thinking about it as like probably like a multi-year implementation where there's going to be budgeting planning involved there's going to be like projections that you have to do, and I think seeing if there are steps along the way that you can take before you get to that ideal, like exactly what Chris is talking about, whether it's offering a contribution to a Coursera or saying, hey, we're going to pay for dental and vision benefits for our workers because those are relatively low compared to health insurance, or seeing if there are like local benefits or offerings, even like what Caleb was discussing with the Firefly telehealth plans. Like there are lots of sort of interim options you can offer your workers that can help meet people's healthcare needs before you're able to offer comprehensive health coverage. Because it is, I mean, working as the Federation, I will get like small co-ops coming to me like today, end of October, being like, we want to offer benefits in 2025, but they don't know how much it costs. They don't know really like what goes into that. And it's usually just not possible to do on that kind of turnaround before you understand the financial commitment. And I think that's really important, both for your health benefits feasibility and also just like your co-op or your business's long-term financial stability.
Yep, great. Thanks, Maddie. Yeah, Caleb.
I think another great avenue if you're looking to offer insurance for your business is obviously have an internal conversation, of potentially what you could afford, what you're looking for. But Maine has a lot of phenomenal brokers. Matthew's here. There are a lot of brokers that you can reach out to. I think they have knowledge of, what can be offered. Individual, small group. If you are a large group, Coursera, ICRA, a lot of different avenues. I think a lot of people think, insurance is just a kind of one kind of stop shop. There's a lot of different programs out there. And those people are really trained in to what can best suit you. And it never hurts to have that conversation, even if it's something that you can't move forward with, that day. It is, I think it's important to know, potentially what you could offer and what are the options out there, because it is continuously changing. Every state's different. So it's, even if you have a background in a different state, Maine is completely different than New Hampshire. So, there's a lot of different avenues, and I think insurance is a scary terminology for a lot of people. And it is confusing to understand. So, just talking to a broker or even reaching out to insurance carriers, they can also help you, point you in the right direction as well. So I think those are amazing steps because there are a lot of different opportunities out there.
Yeah, Matt.
Yeah, I basically where to start is identifying that specific person's needs and understanding what they're going through. Medications, doctors are a big one, and Cover Me has a great tool to research that. And I come up with a cost analysis. So I'll break it down between a bronze, silver, and gold plan and come up with their costs of what the medications would be. And if some of the medications aren't covered, I'll go the extra mile and take a look at GoodRx, Amazon, cost plus drugs, and then outweigh those costs and saying, okay, you can save, let's say $120 a year on this medication going through this avenue. And people will go, okay, then I can use that money towards other parts of the health insurance. That's a big one, and definitely going over there. Yeah, I would say the medications and doctors would be the most important in doing that interview. And explaining to their employer too, everybody's going to be different. So not everybody's going to fit in the community health options box. Not everybody's going to fit into the Anthem box. And coming up with those Kasheras and the ICRAs opens those doors for people to get their own plan that fits their needs directly. And I've been finding that a lot in the last couple of years where their plan's not covering their specialist visits or their treatments because they're on the employer plan. They have no other option. That's a big one. And then I see Sarah has a question about offering 50%. That's completely up to the company, what they can afford. I've seen somewhere between 50 to 100%. And that breaks it up between the employer and the employee and finding that happy medium to keep everybody in business and working. So that's the other part of it too.
Yeah, does Maddie or Caleb, do you all have any thoughts on that question? Is that a typical starting point for covering 50%?
I think on the group side, to be competitive with potentially what an individual plan could cost to the employee, 50% would probably be kind of that starting point. But it's not a requirement. Again, kind of going off what Matt said, it is completely up to the employer. Now, what you contribute though has to be the same for all the same employees in that class. So different employees or employers can have different classes. So like full-time manager, your contribution has to be the same percentage toward every employee because there are discriminatory laws. So just wanted to throw that out there. But yeah, again, it's completely up to the employer. But if you wanted to be competitive against, potential other options like the individual market and other things like that, you would definitely want to talk about what you could afford to contribute toward the employee cost.
Great.
Yeah, and I think that, if you're in a worker co-op particularly, there is, what is typical is going to vary depending on who's in the co-op and what kind of decisions you're making together. And I think like there is, as long as you're working within the confines of the regulations, um, you have the flexibility to figure out what's going to work best for all of you as worker owners. Um, and I think if it's a consumer co-op or a co-op that is not like worker owned or run, then it is going to be a matter of just like being competitive and trying to meet that market um, with any other employer.
Mm-hmm. Yeah, and just from my own experience, having my 25+ year career with some gray hair, and I've worked with large corporations, and down to where I am now with small nonprofits. I've seen from 50% to 100%. That does seem to be the minimum. But what I would say with Cooperative Fund, where they started, is not a percent, but what they could afford, a flat amount for the HRA. So within our budget, they decided, well, per employee, we can contribute this X amount, $5,000, $10,000 a year to go into the HRA, and it's not based on a percent of what my health insurance costs are. Luckily, it does cover most of it. So, my wife and I just realized it's good timing. We're about to run out, which is you want to spend all of the HRA funds by the end of the year. So yeah, that's great. John has a question. He's heard of some small co-ops and employers offer a health stipend instead of health insurance. It sounds like that might be taxable income. And Matt, we've talked about this a little bit. Is that legal? Is that something that should be worked out with their accountant? Or is an HRA a better avenue to pursue so that it's not sort of taxable for the employee or the employer? Yeah.
Yeah, that's definitely a tax question and working closely with your tax accountant about that. And I've gotten a handful of different answers for that and how different people process that or expense it through the business, or like Chris said, it could be a taxable income. But that's something that they definitely need to find the CPA that knows those laws. It can be substantial impact.
Maggie, I saw you nodding your head. Do you have anything to add there?
Yeah, I think when I'm referring to it being legal, it's like it is legal to give someone just sort of like another chunk of cash and say, like, this is your health stipend. It's subject to tax, and you can't control what the person actually spends it on, but it is something that I've heard of a good number of worker co-ops or smaller groups doing as sort of a like, this is our first attempt, just like throw some money at everybody, like we'll figure out the rest later.
Right.
Yeah.
But if they did enroll or help enroll with an HRA, FSA, that's definitely, pre-tax. It's the next formal step, I would think. Brad has a question. If a group or employer was to self-finance primary care, basic testing and common medications, is there an insurance plan available for major expenses? I think what they're talking about is self-insurance. And I'm somewhat familiar with, but is anyone on here familiar with that?
I haven't heard that yet.
I am from my own experience, Brad, I'm actually on the board of a community health center. It's a nonprofit, and because they're a health provider, they actually self-insure their employees, and so they do set aside money. That's basically a pool of money, and then I think they have they do have a reinsurance plan, like catastrophic plan, that if they go above this certain amount, then that kicks in. But I know it's possible. How it works, you'd probably want to talk to an insurance expert, who doesn't necessarily, might know about employer provided health insurance plans, but also can help you construct a self-insurance plan. Those are complicated. You take on a lot of risk. So they can do it because they have the doctors and the nurses and to do all the visits, and they can kind of guess what the usage is, but it can be done. Yeah, Maddie, I saw you come off.
Yeah, I would say there are a lot of brokers who work with self-insurance, which is, exactly as Chris described it. And something that I would just note is that the rates are much more reactive to what people's individual healthcare expenses are. And so it can be difficult, in my opinion, I think there's some risk to doing it with a smaller group of people, because if like one person has a year with some catastrophic health needs, it can make the cost go up for everybody in a way that it doesn't if you're buying insurance off the marketplace or something like that. Um, that said, like, talk to brokers who work with that. Talk to other groups that have worked with those brokers too, I would say.
Yeah, great. One question that came up was, Matt or Kayla, this is a Maine specific question. Can you all talk a little bit about how Maine is different in the pooled insurance set of things versus others? I think most of our participants are in Maine. How is the exchange and the pooled insurance different here in Maine than in other states? Or are we basically the same as other states when it comes to pooled insurance?
So it's all state regulated. So everything's a little bit different because every state has different carriers. So essentially, how Maine kind of comes up with their rates is it's a risk pool. So we saw in 2023, the state decided to merge individual and small group to expand the risk pool due to the population. We had a lot of people go on like a self-insurance, level funded products. A lot of people leaving the state getting older, going on to Medicare. So they expanded the risk pool. So essentially, they kind of look at the rural areas. They look at the greater Portland area. There's now 5 rating areas in 2025 for Maine. So rating area 1, 2, 3. The farther north you go is a different rating area. And kind of the further north that you go in the state of Maine, your insurance premiums will increase because you're further away from care, essentially, is kind of how they're gonna describe that. So like obviously in the greater Portland area, you're gonna be in rating area 1 because we have the major hospitals. So that's kind of how they pool it, is they look at risk of area, but also obviously the population of people. So I can't really speak on the other states and how they do it, but it is a very similar pooling on how they do individual and small group. But other states it's separate, so it doesn't work just like Maine does.
I think we probably should wrap up. One of the I was just kind of taking notes of what should employers do, and some things that I've noted was survey your employees first, kind of what their needs are, how many dependents do they have. Matt, I heard you say that on an individual, but and that's what Cooperative Fund did before we offered the benefits package, was what is everybody's needs, and to help them figure out the best plan. The other is talk to an expert on this. Maddie and Matt is one. Caleb, I think you all usually work through brokers mostly, so that's probably what you would recommend, is working through someone through like Matt. Again, that website that I shared earlier, help find help. There's 2 kinds of folks. There's brokers like Matt, as well as nonprofits are paid by the federal government to help you make the decisions. And then do that plan that Maddie was talking about, of where are we going to start now, sort of in that informal spot of giving a small stipend, or contributing towards an HRA, with a plan in the next 5 years, for example, getting onto a small group plan and really budgeting it out. Again, experts, insurance brokers, that sort of thing can help you get there. Yeah, Maddie, do you have one last?
Yeah, I think one other thing that I would say is, like, if you're at a place of, okay, it's time to survey our employees for what their needs are, is I would also consider sort of who isn't on your staff and maybe
Yeah,
why.
yeah,
Um, because if you're not offering any benefits right now, there are probably people who just can't have a job at your organization. So sort of considering that and what additional needs you might be able to meet with offering a health insurance plan.
yeah.
Um, yeah.
That's a really great point. And Cooperative Fund did that as well, where we were growing. We knew, particularly we wanted a lot younger folks to join. And so we had to sort of anticipate who we wanted to include going forward, and put them in a spot where they need to be. Thank you, Maddie. That's great. Just wanted to point out, and Brad, we might have to get to your question offline. We're getting close to the hour. So Emmy has put in a feedback survey for everyone, as well as, so please do that. Also wanted to point out, thank you, Emmy. We do have a bonus session that's actually not in October, but still related to this webinar series. We're going to cover retirement plans for employers. There is a new mandate called the merit program, where certain employers do have to, most employers will have to offer a plan. We will also, actually, thank you, Maddie, be able to talk about other options that are out there for retirement plans, if the merit plan is not something you want to offer. In particular, I think we'll also talk about some options that are simple IRAs that are for small employers as well. So tune in if you can. Please share out, and we're really happy to have you all join us. And it's still October, so happy Cooperative Month, and happy Employee Ownership Month. And thank you all.